Welcome to another edition of my cancer story. It's been a little while since my last video. When I did my last video, I was recovering from my second surgical procedure. I had just recently had a mastectomy, and a lot has gone on since then. I have started radiation, and radiation is the last part of my treatment, and so hopefully when I'm finished with this, I will be, as my doctors say, cured of my cancer. However, I will still have to take medication for the next several years to help prevent recurrence, but I don't really think that I have anything for the cancer to come back to, seeing as how I did have a mastectomy. Wasn't a double mastectomy, so I guess maybe there's always the other side, but I'll be praying that that doesn't happen. So anyway, as I said, I started radiation. Actually, I'm about halfway through. I'm scheduled for 33 sessions. Not sure how many I've had. There's been several. Probably around about 15, 16 maybe, somewhere in that area. Radiation is actually very easy. It's much easier than chemotherapy, whereas chemotherapy, I was sitting in a chair for 3 to 4 hours getting pumped full of medicine, and then it really just knocked the wind out of me. Very exhausted all the time. Lost all my body hair. Underwent a lot of physical changes. Radiation, not that difficult. I lay on this table for about 15 minutes while this machine kind of goes around and does its thing. The table is quite uncomfortable. I guess that's why they have a mold that's designed specifically for me, which I'm going to show you some pictures of the whole radiation thing that I have to do, so you'll get an idea of what I have to go through 5 days a week, which is not that difficult. Come in, put on the robe, lay on the table, let the machine do its thing, and you're out of there. Only thing I don't like is that it has really caused my skin to get dark. I mean, like terribly dark. I don't know if you can see that, but my skin is quite a bit darker than what it typically is, and all of my hair follicles are starting to show. Not attractive at all. And here, I don't know if you can see this. This is one of my markers, kind of like my map, as they call it, where they need to focus in on the treatment. I have a few of these on my chest. So, you know, outside of the skin discoloration and then these pieces of tape being very uncomfortable, radiation is not that difficult. I'm going to show you pictures of what I have to do for radiation. Like I said previously, I did have a mastectomy, which means I'm a little lopsided, and you know, who wants to walk out the house looking like that? So I did have to go get a prosthetic. That was a little difficult at first, but once I went and did it, I have to say I was very glad I did. It's kind of funny, you know, when you think about it, but I guess it's really no different than when somebody loses an arm or a leg. The thing about a breast prosthetic, though, is that really no one has to know unless you tell them, because it's under your clothes, and the way that they're made and they're fit to you, no one can really tell. So I have mine for you. Mine came in this nice little case. I guess if I do some traveling and want to carry it with me. So I open it up, and here it is. Looks like a part of me, doesn't it? I guess. Uh, Smooth, kind of, I don't know, soft. It has a little weight on it, which is good because it maintains a more realistic look while you're wearing it. Because when I had, like, before I got this, I was wearing like little puffs, kind of like what I have on now, and they tend to rise because they're not as heavy, and so you kind of look like this, and you're constantly trying to push it down, and then you forget that you're in public and people can see you. But this, much better, and it fits into a bra. Bras have a pocket that you just put them into, and there you go. Kind of funny that it's brown. They come in two colors. At least I was offered two colors, brown or I guess the white color. And at first, I was like, well, obviously I'm going with the brown, but then when I thought about it, who's gonna see it? So does it really matter what color that you get? But the thing is, it really goes a long way into helping you get your confidence back. And I really want to thank the ladies at the Women's Health Boutique, because they were really sympathetic and understanding to the situation. In fact, one of them had gone through something similar to what I'd been going through, and so she could definitely understand the feelings that I had about going through that process. And they really do a lot to make you feel comfortable. And the bras that they offer you, very pretty. And I'm not one for a bunch of lace and all of that, but they really do help you feel pretty and womanly and really feminine, because honestly I had kind of felt like I had lost some of that with the mastectomy, even though my husband was telling me that I'm still beautiful, and he wasn't just telling me, he was showing me, and he wasn't treating me any different. Actually, he was a little bit closer to me, where I'm like, ugh, get away. But his actions certainly spoke a little bit louder than his words, and so I guess that really did help me build my confidence too a little bit. So that's that. Actually, something else that I haven't shown you is my sleeve. I have what is called a lymphedema sleeve. Now, everyone in my family likes it. My son and my husband say it's tight. It's tight. Well, yeah, it is a little tight fitting, but they just think it's like the coolest thing because it makes me look like I'm a basketball player. If you watch basketball, you know how a lot of players wear that sleeve on their arm. Well, I have one to help prevent swelling, because when they did my first surgery, they took out several lymph nodes, which of course helped to kill infection. But since they took several out, my arm is more prone to swelling. So there's a lot I can't do with my right arm. Can't have my blood pressure checked on that arm. Can't have needle sticks on that arm. If I get that arm injured, I have to go get it checked out. Repetitive motions, they encourage me to wear my sleeve. If I ever decide to go on a plane, which I doubt, I have to wear my sleeve. If there's a hurricane, which there could be because I do live in a hurricane prone area, I have to wear my sleeve just to keep the swelling down. A little bit nervous about that and going to work because not sure how people will look at it, but I guess I really shouldn't be concerned about that. And lastly, if you notice on all my videos, I do wear some type of hat on my head, and some of you may be wondering why I do that. It's kind of my signature, or it became my signature. But I think in one of my previous videos I mentioned that I did wear a hat because during chemo I had lost all my hair. I mean, I was like completely bald, and not only is that a little, well, was it a little embarrassing for me, my head would get cold, and so I was always wearing a hat to just kind of keep my head covered and keep it warm. Well, today I'm going to do the great hair reveal. It's been, let me see, I guess 4 months since my last chemotherapy session. Yeah, it has been almost a full 4 months. And so my hair has started to grow back. I'm kind of sporting a little afro right now. In fact, you probably can see some of it right here, you know, on my edges, whereas you couldn't see any of that in my prior videos. In fact, I even got some eyebrows. All my eyebrows came back. I didn't have much to begin with. So I'm going to do a hair reveal. So here we go. Hat coming off. So here's my hair. Doesn't look anything like it did pre-chemo. And I'm not sure if it will ever get back to that. But here it is. It is growing back, and it's a little bit exciting. I'm not really feeling it right now because it doesn't do anything that I want it to do. And again, another cause of my anxiety going back to work, because this is not, you know, the old me, and I do want that back. I was pretty proud of my hair, you know, worked hard to kind of keep it maintained and growing. So I'm not sure what I'm going to do with it. I guess I got to hurry up and decide, seeing as how I'm going back next week. My daughter, my youngest daughter, she calls it fluffy, and she likes to pat it and all of that. So I don't really like when she does that, but I guess it doesn't really bother me. So here you have it, me in the all natural, my little fro. So hopefully, you know, by my next video it'll have I'll have a little bit more. I hope. Maybe I'll be able to get a perm, or maybe even put it in a ponytail or something. You never know. Alright, well, thanks for watching, and stay tuned. I'll probably have another one next month when I am finished with my radiation therapy, and we'll see what's next from here.